The world changed dramatically in late 2019, marking the beginning of an unprecedented global event. A new virus emerged, causing a global pandemic that would alter our lives in unimaginable ways. We now know this virus as COVID-19, a term that has become all too familiar. It is caused by a coronavirus called SARS-CoV-2, which has been the focus of intense scientific research. The first cases were identified in Wuhan, China, a city that quickly became the epicenter of the outbreak. Since then, COVID-19 has spread rapidly, affecting millions worldwide and disrupting daily life. COVID-19 is a respiratory illness that primarily targets the lungs. However, it can also impact other organs, leading to a range of complications. The virus is highly contagious and spreads easily from person to person, making it difficult to control. This is mainly through respiratory droplets released when an infected person coughs or sneezes, emphasizing the need for precautions. Understanding COVID-19 is crucial to combating its spread and protecting public health. We must learn how it spreads, how it affects our bodies, and what we can do to protect ourselves and others, including practicing good hygiene and social distancing. This knowledge empowers us to make informed decisions and navigate this challenging time with resilience and hope. SARS-CoV-2 enters the body through the nose or mouth. It travels down the respiratory tract, eventually reaching the lungs. The virus has spike proteins on its surface. These proteins bind to ACE2 receptors on the surface of our cells. Once attached, the virus injects its genetic material into the cell. This hijacks the cell's machinery, forcing it to produce more virus particles. The infected cell then releases these new viruses, which go on to infect other cells. Our immune system responds to the viral invasion. White blood cells, such as T cells and B cells, are deployed to fight the infection. This immune response can sometimes lead to inflammation and damage to healthy tissues. In some cases, COVID-19 can cause severe illness. This is more likely in individuals with underlying health conditions such as heart disease, diabetes, or a weakened immune system. Severe cases can lead to pneumonia, acute respiratory distress syndrome, and even death. COVID-19 shares some similarities with influenza, the flu. Both are respiratory illnesses that can cause fever, cough, and fatigue. However, there are key differences. COVID-19 appears to be more contagious than the flu. It also has a higher mortality rate, meaning it is more likely to be fatal. Another difference is that we have a flu vaccine, but a widely available and effective COVID-19 vaccine is still under development. This highlights the importance of preventive measures to slow the spread of COVID-19. Section 4. Impact on healthcare and preventive measures. The rapid spread of COVID-19 has placed a tremendous strain on healthcare systems worldwide, affecting both developed and developing nations. Hospitals have been overwhelmed with patients, leading to shortages of beds, ventilators, and personal protective equipment, or PPE. This has forced many hospitals to operate beyond their capacity. Healthcare workers are on the front lines of this pandemic, risking their own health to care for others. Their dedication and bravery are commendable. It is crucial that we support them by following public health recommendations and guidelines issued by health authorities. This includes practicing good hygiene, such as frequent hand washing and covering coughs and sneezes. Proper hygiene can significantly reduce the risk of infection. Social distancing is also essential. It helps to minimize the spread of the virus in our communities. This means maintaining a safe distance from others, especially in crowded places, to prevent potential transmission. By limiting our contact with others, we can help slow the spread of the virus and protect the most vulnerable members of our communities. Together we can make a difference. Section 5. Staying informed and supporting healthcare heroes. The COVID-19 pandemic is an evolving situation that has affected every corner of the globe. New information and guidelines are constantly emerging, making it crucial to stay updated. It is our responsibility to stay informed about the latest developments from trusted sources, such as the World Health Organization, or WHO, and the Centers for Disease Control and Prevention, or CDC. These organizations provide essential updates and guidelines. We can all play a role in combating this pandemic by taking simple yet effective actions. By following public health recommendations such as wearing masks and maintaining social distance, we can protect ourselves, our loved ones, and our communities. We must also remember to support our healthcare heroes who are working tirelessly to care for the sick and vulnerable. This is a challenging time, but by working together, supporting each other, and staying informed, we can overcome this pandemic and emerge stronger on the other side. Let's continue to show compassion and resilience.